Namaste everyone, welcome back to my channel. I am Dr. Ankita Savant and today we are going to discuss about hip joint. So it's a weight bearing joint of the lower limb. So the type of the joint we have in hip is ball and socket variety of synovial joint. So what is synovial joint? I have already discussed in my previous video. So kindly have a look on it. I'll be providing the link in the description below. So it's a ball and socket variety of synovial joint. So the head of the femur articulates with the acetabulum of the hip bone, and that particular formation is called hip joint. So the hip joint is unique in having high degrees of stability as well as mobility. All right. So this is the head of the femur, this is the neck and the body of the femur. So head, neck and the rest of the femur bone. So moving further, we'll see the ligaments. In ligaments, first we'll see the fibrous capsule. So this is all, this portion is the fibrous capsule. Okay, so I highly recommend you that while watching my video, please sit with the skeletal so that you can correlate the bony points, origin and insertion, and so likewise the uh, correlate you'll be able to correlate well with my teaching. So fibrous capsule is attached on the hip bone to the acetabular labrum, including the transverse acetabular ligament and the bone above and behind the acetabulum, and on the femur on the intertrochanteric line in front and 1 centimeter medial to intertrochanteric crest behind. So this was all about the fibrous capsule. Okay, so we saw the same capsule in the wrist joint as well. So fibrous capsule, so these capsules are almost there everywhere in the joint. Okay, so moving further on the iliofemoral ligament. Now iliofemoral ligament, name itself suggests that from ilium bone to femur it comes. So it's an inverted Y-shaped ligament. So this is one and this, they're forming Y shape. Okay, so this is the iliofemoral ligament from ilium to the femur. Next bone, it's pubofemoral ligament. Same, pubis bone to femur. So from pubis to femur, pubofemoral ligament. There's one more ligament, we cannot see that ligament in this particular picture. That is because it's situated posteriorly. That is ischiofemoral ligament. Ischium bone of the hip to the femur. Ischiofemoral ligament. Okay. Then there is also one more ligament, the ligament of head of femur. This. Okay. So it's a round ligament. Yeah, it's also called a round ligament or ligamentum teres. So it is a flat and triangular ligament. So there's a fovea capitis situated on the tip of the femoral head. There's a tiny depression. So that ligament of head of femur or round ligament or ligamentum teres starts from there. So relationships. So in relations of the hip joint, anteriorly the tendon of iliopsoas separates from the joint by the bursa and femoral vein, femoral artery and femoral nerve. So this. So this is the joint. यहाँ पे anteriorly we discuss psoas major, femoral nerve, femoral artery and femoral vein. Next, posteriorly, this posterior surfaces we'll see now. Tendon of obturator externus, this obturator externus. Then we'll see covered by the quadratus femoris, obturator internus, gemini, and sciatic nerve, gluteus maximus muscle, piriformis muscle. So all these structures posteriorly, piriformis, sciatic nerve, the structures which are present posteriorly. Then we'll see superior structures. So superiorly, reflected head of the rectus femoris. Okay, rectus femoris we have this full portion. Okay, rectus femoris. Then is covered by gluteus maximus, minimus, partly maximus, gluteus medius and minimus more appropriately, and partly this maximus. Then will come inferiorly. Inferiorly, we have pectinis, we have gracilis, obturator externus. In addition, we can see gracilis, adductor longus, brevis, magnus, and hamstring muscle. So hamstring हो गया, adductor magnus, adductor brevis, adductor longus, gracilis, pectinis, all are the inferior structures, relationships. Moving further to the blood supply now. So obturator artery, particularly hip joint को who supplies blood circulation? Obturator artery, two circumflex femoral and two gluteal arteries. Nerve supply, femoral nerve, obturator nerve, superior gluteal nerve. Now moving further to the movements. See, this is a very basic video. In coming time, after completion of the whole anatomy, I'll be covering biomechanics particularly. Physio point of view, biomechanics I'll be covering. So it's better to just brush up on the anatomy first, then going deep into the biomechanics. So the hip movements, we have flexion and extension, which occurs in transverse axis, adduction and abduction in anterior posterior axis, medial lateral rotation in vertical axis, and circumduction is a combination of the foregoing movement. Okay. Now we'll see the clinical anatomy. There are dislocations of the hip. Congenital acquired dislocations we can see posteriorly in particularly. Neck of femur fracture is very much prone in old age, osteoporosis cases and all. Trochanteric bursitis, long standing or runners in mostly seen in runners. Osteoarthritis, weight bearing joints, reduced space, inflammation is there. Perth's disease, in this there is destruction and flattening of the head of the femur. Avulsion fractures are also there. Avascular necrosis, blood supply to the bone is hampered. So very painful condition. Suas syndrome is also one of the condition which we need to take care for differential diagnosis and all. And Suas syndrome, particularly seen in dancers or joggers, runners, we can see overuse basically of psoas major muscle. So that was all about the basic anatomy of the hip joint. So I hope you liked the video and it was useful for you to just brush up the knowledge. So in next video I'll be covering knee joint anatomy. So stay tuned for the same. Thank you so much. Keep learning.